Welcome to the Future of Public Health. This webinar is an introduction to Public Health 3.0. Well, what is Public Health 3.0 and what does it mean for public health departments? How can it help health departments improve the health of their communities? Public Health 3.0 is a call to action to all of us working in public health. It's a new way to think about what we need to do to create health in our communities and how we can be more effective. By the end of this webinar, you will be familiar with the concept of Public Health 3.0, what it means, and why it's important for you to know about. You will know what the Public Health 3.0 recommendations are and how they can be applied by a health department. The role of the health department as the community health strategist will be reviewed. The concept of a community health strategist is the core and the most important recommendation of the Public Health 3.0. It is this concept that is the most powerful and transformative part of Public Health 3.0. There are 5 recommendations altogether, and this webinar will touch on each of them. But the concepts and activities advanced by the role of the community health strategy is really what Public Health 3.0 is all about. Finally, we'll share with you the primary source documents for Public Health 3.0, the documents that introduce and explain Public Health 3.0. Public Health 3.0 builds on the understanding that to create lasting improvements in the population's health, public health professionals need to focus on the social determinants of health. Social determinants are the conditions or environments in which people are born, grow, live, learn, work, play, and grow old. Social determinants are about opportunities and access. Access to, for example, good education, safe and secure housing, strong social capital and community resilience, safe streets, nutritious foods, safe drinking water, and clean air. Access to these opportunities are shaped by the distribution of money, power, and resources. Access to these opportunities depend to a great degree on where you live, even down to the zip code. Differences in the social determinants of health are the result of unfair, systemic, and avoidable differences in health status, that is, health inequities. In the context of the history of Public Health 3.0 is now and the future of public health. Public Health 1.0 refers to the late 19th century through much of the 20th century, when public health expanded its understanding of diseases, developed vaccines and antibiotics, and increased epidemiology and laboratory science. During that time, community public health efforts addressed the environment in which people lived, improved sewer systems, safer water, safer housing, better education, increased literacy, and improved access to health care. Public Health 2.0 began in the second half of the 20th century. Public Health 2.0 faced a new era of chronic diseases as the leading causes of death. Public health then focused on providing information to individuals in an effort to change discrete and individual behaviors, such as tobacco use, physical activity, diet, alcohol, and substance use. Now, Public Health 3.0 provides a framework for how public health can be effective in addressing today's public health challenges. Today, public health has the heavy burden of not only addressing chronic diseases and new communicable diseases, but also behavioral health, such as substance use disorder, mental health issues, and gun violence. The focus now is on efforts that will impact communities where people live to improve the population's health. Public Health 3.0 recognizes that focusing on individuals has limited impact. We need to focus on the social determinants of health to create healthy communities. It's important to think broadly about the environments that promote or discourage good health. When we do that, it's easy to understand how health equity is a key component of today's public health discipline. How can the public health field address these big issues? Well, it certainly cannot do it by itself. Public health departments must develop true collaboration, shared responsibility, and mobilized community resources for collective action and impact. Cross-sectoral collaboration and collective actions are at the core of Public Health 3.0. The framework includes a strong local public health infrastructure with stakeholders across multiple sectors working together to address the social determinants of health. Public Health 3.0 promotes the concept of shared accountability across community sectors. So that's the overarching concept. And now let's look at the Public Health 3.0 model in more detail. A little bit of history about Public Health 3.0. Where did it come from and how was it developed? The term was developed in 2016 by the U.S. Department of Health and Human Services in a report called Public Health 3.0, a call to action to create a 21st century public health infrastructure. The report challenges public health to reinvent itself to effectively address social determinants and health equity. The report describes a new model for public health where communities lead the charge of taking public health to the next level. Local public health is where the action is. It's the cutting edge work it's where the cutting edge work is accomplished. A few key example data points provide evidence that social, built, and policy environments are key determinations of a population's health. Social circumstances, behavior patterns, and environmental exposure account for as much as 60% of premature deaths. Life expectancy can vary as much as 25 years between neighborhoods in the same city. Potential polluting firms are more likely to build their facilities in poorer areas where the risk of litigation following the release of pollutants would be lower than in higher income areas. Racial and ethnic minorities have greater proportions of chronic disease and premature death compared to whites. Well, these are all community level issues. Addressing them requires changes in the community environments, that is, the social, policy built, decision-making, and collaborative environments. Health equity is key to each of these four examples. Public health's effectiveness is limited if it focuses only on the individual healthcare, individual health education, individual behavior change. These are big challenges that can seem overwhelming. Can public health have an impact on these community level issues? Yes, these community level issues are not insurmountable. Behavior can be changed at the community level by shifting social norms, laws, and policies. Think about smoking, seatbelts, and the availability of bottled water. These issues have all made a huge turnaround. For example, and some of you may not believe this, but at one time, every conference room table had ashtrays on it because it was acceptable to smoke during meetings, and people did. At one time, there were smoking sections in movie theaters with ashtrays affixed to the back of the seat in front of you. Cigarettes were available in vending machines everywhere. Society promoted cigarettes in every direction you turn, but not anymore. Through changes in policy, laws, and norms, tobacco use is no longer promoted everywhere. Health impact assessments, or HIAs, assess the potential effects of policies, programs, or projects on the health of the population and the distribution of those effects within the population before they're implemented. Environmental justice works to ensure that no group of people bears disproportionate negative consequences from environmental, industrial, governmental, or commercial operations or policies. And racism is now recognized as a public health emergency, and health departments are addressing health equity head-on. Local health departments across the country are developing long-term relationships with their community in confronting the social justice inequalities that are at the root of health inequities. So these are examples of public health taking on those big issues. The Public Health 3.0 model requires that local public health departments prioritize attention on the social determinants of health. They do this through deliberate collaboration across health and non-health sectors, especially with non-traditional partners. Well, let's look at what's recommended to achieve this. The Public Health 3.0 report makes 5 recommendations for the implementation of Public Health 3.0. The recommendations describe changes that are needed to support local health departments as they work to transform governmental public health. We'll talk about each of the recommendations. The most important one is that first one, the Chief Health Strategist. That's the one we'll spend most of the time on. The first recommendation is that public health leaders need to serve as community health strategists for their communities, mobilizing community action, forming strategic partnerships across sectors and jurisdictions, and strengthening community infrastructure. The Public Health 3.0 report, it talks about the Chief Health Strategist. However, since the report was issued, the field has changed the name to Community Health Strategist. Many felt that the word chief could be viewed by community members as controlling, even arrogant. The term community health strategist more accurately communicates and reflects the intention of promoting partnerships and mobilizing community assets. NACCHO, for example, uses community health strategist, and we will use community health strategist in this webinar. So the community health strategist works with community partners to drive initiatives and interventions upstream in order to address the root causes of poor health. Partnerships are necessary to develop and share resources and community assets and to leverage data for action. The concept is that the health department works with communities and does not simply provide services. The health department does not do things to the community or for the community, but with the community. What does it mean on a day-to-day basis to be a community health strategist? Well, a report developed by the Public Health Leadership Forum, the report's called the High Achieving Governmental Health Department in 2020 as the Community Chief Health Strategist. It presents 7 key practices of a community health strategist. We'll review the high-level points of each of these practices that pertain to a local health department. It should be noted that the 7 practices call for a rethinking of the role of local public health. The role suggests a sweeping set of new responsibilities. First, who is the community health strategist? Well, the report has been written with one person designated as the community health strategist, the health department director. However, the entire health department must think like a community health strategist. Each and every person at the health department is important. How each person in the department performs their responsibilities, how they relate to the community, will determine how successful the department is in living the strategies and improving the health of their communities. Every staff person is a part of the team, and the team members need to look for root causes, be a partner with the community, and support each other. The first key practice of a community health strategist has to do with, well, yes, developing effective strategies. The most effective solutions for chronic conditions are often similar across disease categories. There are widespread benefits of improved conditions in the community, such as access to fresh fruits and vegetables, or parks and other open spaces to support improved diet and exercise. The report says that health departments need to focus not only on what is threatening good health, but also who is most at risk. The second key practice drills down into what kind of strategies. The report notes that to date, public health strategies have not been very effective at reducing class and racial health disparities. Future strategies will require health equity approaches. So the high achieving health department uses strategies that address emerging demographic patterns, the who is at risk, and the health equities experienced by those at risk. Use a health equity lens to think about the root causes. The third key practice for the health department as a community health strategist relates to health information. Well, public health has always been an information-based discipline. Right from that day in 1854, when John Snow plotted the cholera cases on a map of London, and he saw that they clustered around a single water pump. Based on that information, he removed the pump handle and prevented the further spread of cholera. But new sources of data provide big data, that is, data sets that are so complex and large that the traditional processing and management approaches are not effective. Health departments need to use data from a variety of sources. For example, data from city planners, schools, hospitals, even public safety officials. Of course, these data must be analyzed and translated into trends with health implications. Information must be shared with providers, partnering agencies, and policymakers to inform community-wide decision-making and collaborative actions. The goal will be a more comprehensive picture of health that will deepen the understanding of the complex factors affecting the health of the community. The fourth key practice is to integrate clinical care in public health. The report recommends that health departments carefully analyze the available and accessible clinical services in their communities and determine if the health department should provide them, at what level, and for whom. Then the health department can take advantage of the numerous opportunities to join efforts with clinical providers and insurers. For example, smoking cessation treatment can be linked with community-level prevention. Collaboration is the fifth key practice. Collaboration is central to the effectiveness of public health efforts to improve health status. The strategist health department will establish effective partnerships with others and will support community-based coalitions that examine health data, set goals, and develop plans to improve health. The health strategist must enlist civic and other community leaders, such as local businesses and the Chamber of Commerce, as well as leaders at the grassroots level to help carry out those plans. Well, that's easy to say, isn't it? It has been said that collaboration is an unnatural act engaged in by non-consenting adults. But all kidding aside, collaboration is hard work, and public health needs to think outside of the box when thinking about potential partners. The sixth key practice is to modernize and replace outdated organizational practices with state-of-the-art business, accountability, and financing systems. Health departments need to create a learning system in which science, informatics, incentives, and culture are aligned for continuous improvement and innovation. Performance management and continuous quality improvement are key. The seventh and final key practice is that of the community health strategist works with federal partners. The report states that federal government agencies need to make funding more flexible and make it easier to braid federal funding. Transformation requires a change in the way the federal agencies interact with local health officials. Public health professionals need specific skills if they're going to be effective in community health strategists. Partnership building and collaboration are critical skills. Authentic partnerships across sectors are required for mutual understanding, shared responsibility, collective action, and improved effectiveness. The skills to mobilize assets for action is needed. Every community has assets and resources that can be mobilized and used in innovative ways for community health improvement and equity promotion. Community assets include things like schools of higher ed, parks, farmers markets, community civic organizations, community gathering places, and community members who are thought leaders or influencers. Asset mobilization requires partnerships. Public health needs to look beyond the common data of mortality, morbidity, years of productive life lost, and behavioral risk factors. Open source data, big data, and social media are potential data sources. Of course, data analysis skills are critical. To act as health strategists, the health department needs staff to be systems thinkers. Communities are complex systems with many moving parts. Each part impacts and influences the other parts. So one change may have positive or negative consequences somewhere else. Health departments need to consider how small changes can have large impacts. Community systems thinking is complicated. So how do we engage in community systems thinking? Well, we need to look upstream to address the root causes of poor health. Root causes like poverty, discrimination, lack of access to resources, unhealthy built environments. They are also the root causes of health inequities. They are also the social determinants of health. The root causes are the systems and structures in our communities. So root causes, health equity, and social determinants of health are not unrelated. They're not standalone concepts. Rather, they're interwoven in our public health work. The community health strategist and the health department need to understand the community's complex systems and structures. Systems thinking and strategies to transform public health are needed to address root causes, health equity, social determinants, and to create healthy communities. Well, that's the first Public Health 3.0 recommendation, but we'll go through the rest of the recommendations quickly. The second Public Health 3.0 recommendation focuses on the need to maintain innovative and sustained partnerships. Effective partnerships have a shared vision, which allows agreements on long-term roadmaps for creating health equity and resilience in communities. So you can see the themes here: partnerships, collaboration, shared responsibility, health equity. Public health departments need to engage with community stakeholders across both the public and private sectors to form vibrant partnerships designed to develop and guide Public Health 3.0 style initiatives and to foster shared funding, services, governance, and collective actions. Partnerships are a must for any effort to address root causes. Examples of successful cross-sector collaborations are plentiful. However, collaborations must be developed specific to the community and build on the strength and assets of the community. As an example, how can church-owned vans that sit idle much of the week be used to transport residents to farmers markets where they can purchase healthy foods? Well, it can be very powerful to start by looking at the assets rather than the challenges. That is, assessing the community assets and strengths and how they can be mobilized to improve health rather than focus on the community's deficits and problems. Examples of questions to ask for creative thinking about collaborations include: how can traffic patterns decrease gun violence? Can empty lots be turned into playgrounds or gardens? How do housing and zoning policies impact health equity? How can all sectors of the community working together address drug misuse? What are unused community assets? Can an empty storefront be used for a high school student's art gallery to learn what the students' representation of the community is, to learn what they see and feel? Well, Public Health 3.0 says that every person in the United States should be served by a nationally accredited health department. The Public Health Accreditation Board, or FAB, is the national organization that administers voluntary public health department accreditation. FAB's accreditation assesses the health department's capacity to carry out the 10 essential public health services. The requirements for accreditation have been revised twice since they were originally adopted. The current version is the Standards and Measures version 2022. Why accreditation? Public Health Department accreditation is supported by Public Health 3.0 because it encourages cross-sector partnerships and collaborations. It requires performance measurement and management. It fosters a culture of quality improvement, and it promotes ongoing communication and partnership with the community. Public Health 3.0 recommends the timely, reliable, granular level sub-county and actionable data be made accessible to community members. Data will guide, focus, and assess the impact of public health initiatives. Public Health 3.0 states that community level data should address the social determinants of health. For example, housing, unemployment, education, access to foods, environmental exposures, and indicators of social capital. Data are also needed that provide information relating to race and ethnicity, language, and gender identity or sexual orientation. Further, accessible and usable sub-county level data are needed. It's well known that life expectancy varies from zip code to zip code. Therefore, zip code level data are required. Geographic information systems and mapping analytic tools are needed. Raw data, primary data specific to your communities, can be collected from the community by conducting community forums, fielding online surveys, convening focus groups, conducting key informant interviews, having listening sessions. Some health departments can use open web pages for community input and collaboration. And this can be a powerful source of valuable knowledge about the community. Electronic health records can also yield invaluable data about health concerns and needs. Well, finally, the last of the 5 areas of Public Health 3.0 recommendation concerns how public health is funded. Public Health 3.0 supports innovative funding models to support Public Health 3.0 style leadership and prevention initiatives. Funding must be identified to support core infrastructure, as well as community level work to address the social determinants of health. Health departments need to be innovative about funding and about using community assets and resources. Because not-for-profit hospitals are tax exempt, they're required by the IRS to demonstrate that they provide a benefit to their community. Communities should examine how to best use this community benefit requirement. Public health agencies and academic institutions could work together to calculate the funding gap, the difference between the costs of providing public health foundational capabilities and the current funding level, and communicate these figures in the context of forging new partnerships and expanding funding sources. Sources of funds can be accessed in innovative ways through partnerships. Other community assets should also be identified. As an example, colleges can contribute expertise in various topic areas and analytical skills. They can also provide interns to help with data analysis, accreditation documentation, quality improvement processes, and community programs. So as a summary, major Public Health 3.0 themes are addressed with many public health models, including partnerships, health equity, social determinants of health, community collaborations, and community-focused changes and interventions. Public Health 3.0 hinges on public health directors serving as community health strategists and health departments implementing community health strategist concepts and opportunities. As strategists, health departments can leverage multi-sector collaboration, cooperation across the community, and broader public health and health system will be necessary to assure health equity for everyone, regardless of race and ethnicity, gender identity or sexual orientation, zip code, or income. For local public health leaders to step up to this challenge, they will need to partner across sectors, work with their communities, and learn about assets and resources, and transform public health departments. Finally, these are the primary resources for Public Health 3.0. They're in the box at the top. The Public Health 3.0, a call to action to create 21st century public health infrastructure, is the go-to report to learn about Public Health 3.0. The High Achieving Governmental Health Department in 2020, as the Community Chief Health Strategist, is the report that focuses on the implementation of the Community Health Strategist role. Now, other papers, interviews, and videos that present Public Health 3.0 can be found on the internet. A few are listed on the bottom box. These resources build on the two documents in the top box. The video listed there, Tale of Two Zip Codes, is from California. And it's listed because it's an excellent short video about disparities in health by geography. Public Health 3.0 is a conceptual framework, but it has real-life implications for public health work at the community level and for the health of our communities. Thank you for your interest in transforming public health now and in the future.